Tomosynthesis is 3D mammography. In addition to taking the regular 2D mammogram, which is basically 2 views of each breast, the tomosynthesis portion of the study allows us to take a data set by the tube making a small movement during the procedure, creating a large number of images, which could be from 40 to 70 images, through each breast in each projection. And so now we're able to see deep inside the breast tissue and actually, maybe see a mass better when it was smaller before you would see it on the regular mammogram. So you can kind of think of it as a CAT scan where you're previously just seeing things from 2 dimensions, from the side, from the top, but now we're actually taking small slices through each of those projections. If you're really paying attention when you get your mammogram, you'd notice that the tech will position you, take one picture. Now what will happen is they will take that picture, then the tube will rotate and generate that 3-dimensional data set. The tech will reposition you in the opposite direction, take a picture, and then the tube will rotate. Unless you're really paying attention to what's going on, and this is something you do every day, which most women don't, they're probably not going to notice any difference. As the radiologist, yes, now I have 5,000 images to look at rather than just four pictures. We are going to detect at least 10% more cancers the first year we're doing this. After that, we won't detect quite as many as we did the first year, but during the first year, you're going to detect a lot of small cancers that you couldn't otherwise see on the routine mammogram.
Has that held true? Have you?
Yes. We've already found probably now 6 or 7, 8 cancers that we wouldn't have seen on the routine mammogram using the tomosynthesis. But what would have happened otherwise is it wouldn't have presented maybe until next year or 2 years later, and it may have by that time spread to the lymph nodes. So the whole goal of screening is to find the cancer when it's small and hasn't yet spread to the lymph nodes. And that's what the tomosynthesis will allow us to do. It's still not perfect. We're still not going to find every cancer, but we're going to have a better chance of finding the cancers when they're small and curable.